For those of you who don't know my story, I had a severe, massive stroke a year and a half ago. I was totally paralyzed on my left side for a full month. It took me 4 months to be able to get out of bed and get into a wheelchair. I could only sit in the wheelchair about 5 minutes before I was so exhausted I had to get back into bed. And whenever I tried to get an idea of what kind of progress in recovery I could expect, the answer I got was every stroke is different, every stroke is different, and it drove me nuts. So I'm trying to document my journey, and if you've had a severe stroke, give you an idea on what you can expect. One of the most important things in your recovery is going to be a physical therapist. You'll get some of that when you're in hospital, you'll get some of that when you're in skilled nursing. But once you're done with skilled nursing and they release you from that and you want to continue your journey, you need to find a physical therapist. So this is going to be my hints on how to find a physical therapist. I hope you enjoy.
Have you ever thought that you could benefit from physical therapy but don't know what to do or how to get it started? Well, I'm going to go through a little video and give you some instruction on how to pick a therapist, what to expect, what to look for, and what kind of things that you should be careful of so that you get your money's worth on this very critical stage in your recovery from whatever your injury is. And you'll want to interview a couple of them to make sure you match your needs with their skills, and that's an important consideration. There are several types of therapy that you can get. There's physical therapy, occupational therapy, speech therapy, vision therapy, and several other kinds. And your need, why you want physical therapy, could be because of a brain injury like what I had, which is the medical term for a stroke. I had a stroke a year and a half ago, and I go to physical therapy twice a week. A year and a half later, and I work really hard, and I can walk now. And considering that I started out totally paralyzed on my whole left side, that's a big deal. But there are things that I'm learning now that I wish I had known a year and a half ago because my progress would have been a lot faster. So I'm going to go over that with you. So your need could be from a brain injury to just working on balance so you don't fall. If you're getting to be an older adult and you feel a little unsteady like you're going to fall, physical therapy can help you not fall. One of the things that you're going to want to decide is how often to go, if 3 times a week is better than 2, or if it's not a good use of time. My therapist has told me that 3 times a week is not much better than 2 times a week, and it'll burn through my insurance a lot faster. So I go twice a week. When you're interviewing your potential therapist, which we're going to interview my therapist in the next video. So this is just kind of a background discussion, but I'm actually going to interview her and ask her all these questions that I'm going over with you. So you will have real life experience, and I'll show you her gym or studio or whatever you call them and her equipment, and it'll be very educational if you want therapy. So one of the things that you want to discuss is what results you're looking for or what your expectations are. And an experienced therapist should be able to answer this question for you. So they eventually graduated me to a therapist who specializes in brain injury, which is what my issue is. And I would never have known that I needed to have a specialized brain injury therapist if the other orthotic therapist had not sent me over there. So if you can learn that and get with the right kind of therapy. Another thing you're going to want to find out, aside from the equipment that they have, including parallel bars, a harness, stairs, things like that, one of the things you're going to want to find out is how much actual therapy time you're going to get during your appointment. And one of the things that therapists love to do is put you on a bicycle someplace and have you pedal away unsupervised, where they're not correcting anything that you're doing wrong while they're working with another patient. And that kind of rubs me the wrong way when it's my money going towards them, but they're actually working with another patient or client or whatever you want to call them. So pay attention to how much time they're actually going to be spending with you versus with somebody else. And you want to look at the physical therapist's educational qualifications too. A real physical therapist actually has a PhD in physical therapy. What you'll generally get at a physical therapy place is a physical therapist technician who stands there and watches while you do the various exercises, but isn't going to be correcting you the same way a physical therapist would do. And that was one of the big things that I noticed when I switched over from a technician to a real physical therapist. She'd say, oh, you're not holding your hips right. Oh, you need to move this forward. Oh, you need to put that back. You need to do this. You need to do that. She corrected me constantly to break some bad habits that the other ones had let me develop. So that's kind of important, what kind of education they have, what kind of experience they have, whether they've worked in ICUs with critically injured acute care people, or whether their experience aligns with what it is that you need. Another thing that you have to watch out for if insurance is paying for it is not to let the insurance lapse. And that's the problem. Mine has lapsed a couple of times. And it's not that it's technically lapsed, it's just that the insurance company wants feedback on your progress in order to reauthorize the visit. So mine only approves 20 visits at a time, and then we have to get reauthorized. And if my physical therapist office is not right on that, then what happens is it takes a week or two for me to get reauthorized. And not only do I lose my slots, but I lose my training as well. And so be careful of that. And another thing, when they're doing the assessments that they provide to your insurance company, they also provide it to your doctor in most cases. You want to make sure you don't get kicked out of physical therapy. And there's a couple ways that you can get kicked out. And the first is failure to progress. If you're not working hard enough, you'll get kicked out if you blow off physical therapy or cancel your appointments and just never come or show interest. You'll get kicked off. And interestingly, the one to get kicked out, which is the one I'm vying for, is when you're cured. So when you're cured, they stop the physical therapy, which does make sense. But you don't want to get kicked out for failure to progress, because then you're going to be really hard pressed to get into another physical therapy place. So these are things that you want to be careful of and mindful of and watch out for as you're lining up a physical therapist and interviewing them and going to their gym and looking what they've got, seeing what their education is, seeing what their experience is, see what their qualifications are. So when I interview my actual therapist, which I'll do within the next week or so, and she has a list of all these questions so she can be ready, this will be a very helpful tool for you to get your own physical therapist, because not only can you waste a lot of money using the wrong one, but you can fail to progress, and bad habits can creep in that you have to work really hard to get rid of. So I hope this was educational, and check back in a couple of weeks and I'll have the interview with my actual therapist. Thanks for watching and good luck with your recovery. Bye now.